Hi, my name is Ogweno Stephen and I'm a global health expert. I'm also a person with lived experience when it comes to non-communicable diseases, having been born with childhood obesity and later on developing chronic hypertension when I was just 16 years old. Today, I'll be talking to you about the United Nations high-level meeting happening in 2025, which is going to be the fourth United Nations high-level meeting on non-communicable diseases. And further, I'll be talking to you about the 4 key priorities or the 4 key asks that the World Heart Federation, in collaboration with global experts on cardiovascular health, are proposing at this United Nations high-level meeting in order to see an improvement in non-communicable diseases, and particularly for cardiovascular health and cardiovascular wellness moving forward as a priority that is being adopted by nations and countries at the United Nations high-level meeting. And without further ado, let's roll. The first commitment that the global experts on cardiovascular health and cardiovascular diseases, in collaboration with the World Heart Federation, are proposing to the United Nations high-level meeting on non-communicable diseases in 2025 is for them to adopt a bold political declaration on non-communicable diseases. This bold political declaration ensures that we have the support to be able to really implement policies, programs, and channel funding to ensure that we're able to save lives and improve health and wellness for all NCDs, including cardiovascular diseases, and on improving cardiovascular health. This is the first commitment that the United Nations high-level meeting on non-communicable diseases are requested to really adopt and to really come out strongly and support. The second commitment that the global community of experts on cardiovascular health in collaboration with the World Heart Federation are asking of the gathering at the United Nations high-level meeting on NCDs in 2025 is the adoption of national cardiovascular health and cardiovascular wellness plans. By adopting national plans at every nation, there is a huge promise of return on investments, on life saved, on diseases averted, on deaths averted, but also in the quality of life in these countries that individuals exist in. And so, in order for us to save lives, in order for us to improve cardiovascular health and wellness, in order for us to see healthier, more productive populations that bring huge returns on the countries, we are asking of the United Nations high-level meeting to adopt a solid national plan that focuses on cardiovascular health and that focuses on improving health and wellness of the communities that they live in. If there is anything that really has been a failure when you look at the Vision 2030, this would be implementation. When the Vision 2030 was being developed, incredible plans were developed, incredible policies were developed. However, we had a failure in implementation. And this brings me to the third commitment that this global collective of cardiovascular health experts in collaboration with the World Heart Federation are requesting of the gathering at the United Nations high-level meeting in 2025, which is a focus on implementation. By implementing policies that have already been developed and have already been well thought through and researched, evidence shows that countries will be able to make huge gains with up to 30% reduction in death and suffering by just implementing the already existing policies. Policies on alcohol use, policies on tobacco taxation, following through with policies on food policies. And by implementing fully these policies and by implementing plans that have been developed up there on the national cardiovascular health plans, we are really looking at a possibility of saving much more lives and of improving the health and wellness of communities. And this is the third ask that this global collective is asking at the United Nations high-level meeting, that it's time we've done a lot of talking, time to move into action, time to implement. And finally, the fourth ask is support evidence-based action for cardiovascular health. Here, we are looking at asking of the gathering at the United Nations high-level meeting to adopt a series of evidence-based actions that have been shown to improve cardiovascular health across the board. And this includes actions like, adopting healthy eating for all and looking at the food policy environments. Actions like universal health coverage, ensuring that individuals have access to healthcare when they need it the most. Actions like involving people living with non-communicable diseases in the design, implementation, monitoring, and evaluation of projects and processes around cardiovascular health and wellness, and even broadly around the various non-communicable diseases. By implementing these and many more evidence-based actions for cardiovascular health, we are hoping and looking at lives that will be improved and societies that have better cardiovascular health, less death and suffering from cardiovascular diseases, and more productive societies. And these are the four key asks that the global experts on cardiovascular health, in collaboration with the World Heart Federation, are asking of the gathering at the 4th United Nations high-level meeting in 2025. Thank you, and see you on the next one.